Welcome to the Health Workforce Technical Assistance Center's webinar series. This webinar is entitled First Generation College Students in the Health Professions, and it was presented on July 13th by Laura Wagner, along with guest moderator Polly Pittman. My name is David Armstrong, and I'm the director of the Health Workforce Technical Assistance Center. And today's webinar is the fourth in our Health Equity Center, and it is about first generation college students in the health professions. And for those of you who missed our previous events, they're all available for viewing on our website at healthworkforceta.org. Simply visit our media library. Now, with that said, I'm going to go ahead and turn the event over to our moderator, Polly Pittman. Polly is from the Fitzhugh Mullen Institute for Health Equity, located at George Washington University. Polly?
Thank you. It's great to be here, and thanks for inviting me to chair this panel or this presentation. I am very excited to introduce Laura. Dr. Laura Wagner is faculty at the University of California in San Francisco. She's a member of the Health Force Center at UCSF, which is well known to those of us who study health workforce. Of course, they have one of the sister health workforce research centers funded by HRSA. Laura is an associate professor in the Department of Community Health and specialty director of the Adult Gerontology Primary Care Nurse Practitioner Program at UCSF. She previously worked for the New York University College of Nursing and Baycrest Health Sciences and the University of Toronto in Ontario, where she still maintains an active research appointment. Dr. Wagner's program of research has focused on improving patient safety and quality improvement skills among nurses. As a result of this work, she's directly participated on a national panel to develop a standard warning label for portable bed rails and led the development of international best practices guidelines for the use of restraint alternatives. She had received her doctoral degree from Emory University and her training as a geriatric nurse practitioner at the University of Pennsylvania. She is a member of the American Academy of Nursing. And of course, she in 2017 founded this program that we're going to be hearing about, which is called FirstGenRN Program. It's a program that aims to provide career development to nurses who are the first in their family to attend and graduate from college. So we're very excited to hear from Dr. Wagner today. This is a very hot topic, actually, as we think about diversity, the importance of diversity in the workforce and how that relates to health equity outcomes. And this is a very concrete strategy that appears to be quite promising, and we're very excited to hear from you, Laura. So I will turn it over to you.
I want to thank the Workforce Center for can you see my screen? Thank the Workforce Center for the invitation to talk about my project. This is, as Polly mentioned, I founded this project back in 2017, and I'll talk a little bit about what the components of the project are. And as was said, the title of my project is First Generation College Students in the Health Professions. So I want to give a plug for the UCSF Health Workforce Research Center on Long-Term Care. Our mission is really to answer the question, how is our workforce prepared to meet the growing long-term care needs of the US population? So we really focus on research that's focused on outside of the acute care setting. So long-term care services and supports, nursing homes, home care, any range of long-term care that's focused in the community. And we really look at policy-oriented research. We focus on the workforce and really, again, how can we deliver high quality, efficient long-term care? I first want to start off by saying, who are first-generation college students? What is the definition of that? And if you look at the Department of Education's definition, it's in short, a student whose neither parent has graduated from college with a bachelor's degree. So if a student's one parent, let's say the father, generally it's the father, if the father has a bachelor's degree and the mother does not have a bachelor's degree, that is not a first generation college student. If the parent or parents attended maybe a trade school or a community college, that student is still considered first generation college student if they are attaining a higher degree as a baccalaureate student. Then we also have students who may not know what one of their parents' highest level of education is. So those students may still be considered a first-generation college student if it was an unknown and maybe they knew what the status of one of their parents were. So that's the Department of Education definition. I wrote this blog post for NASPA. It's a higher education association that started the Center for First Generation Student Success a few years ago. UCSF was an inaugural institution for first generation student success. So we were the first, also focused on health professions. And so as part of that inaugural launching, we wrote a blog post with the title, Why Are First Generation College Students Essential to Improving Our Nation's Health? So there's the web link there if you want to go and read the article. And really the focus on this is focused on, we have research to support that culturally, socially, and racially concordant care results in significantly better health outcomes for patients. And so I'm happy to provide the references on these, but patients are more likely to choose a provider who's the same race, who speaks their same language. Race concordant visits have better ratings, more satisfaction. They're more likely to be involved, less likely to delay care, more timely treatment and resolution of screening findings. And we also know that when there's this low social concordance, the match again, then there's less positive care that's provided. Now, I do want to say that this research has primarily been focused on physicians and the relationship that physicians have with their patients. So maybe we can have a discussion at the end about other healthcare providers in the health professions and how we can increase this concordant care that's involved. This talk today is really just perfect timing because just a few weeks ago on June 25th, the Biden administration issued an executive order on diversity, equity, and inclusion in the federal workforce. And in Section 2, I've highlighted it here for you, they've termed, trying to increase the workforce and the diversity, they've termed underserved communities, and they go through a whole list. I've just cut out a few items here, but in the context of the federal workforce, this term includes individuals who, whole list of things. It all includes first generation professionals or first generation college students. So you can imagine the people in my space were really excited when we saw this, this come out as a presidential action just a few weeks ago. So this talk is, as I said, perfectly timed. What are some challenges that first generation college students face? And so I'm going to just go through this whole list. Again, I'm happy to share some of the research that I have been able to find on this in my exploration of beginning this program back in 2016, 2017. They delay entry to college or university after high school. They likely are first in attending associate degree programs at community colleges. Another challenge is that they're attending school part-time. So they may be attending school part-time or even full-time and working. So they have this like split life where they have multiple things that they have to juggle. They work full-time while in school. So they're working full-time, they're in school full-time, and they might also have children that they're taking care of. Many of them are more likely to be financially independent from their parents, receiving financial support. They might be a single parent. There are higher attrition rates, students who end up leaving school for various reasons. Many of them, which I have already named, the challenges that they face might lead them to not complete college. They achieve lower GPAs, overall GPAs. They may take a longer time to graduate. And we also have research that the NCLEX-RN, which is the licensure examination for nurses, is also lower among those who are second language speakers. Now, I want to first say that personally, I'm the first in my family and the only person in my family to graduate from college. And so this program that I founded in 2016, 2017 is really a personal passion. And it came out of this list in seeing my students as a program director of a nurse practitioner program and my advisees facing these challenges and me personalizing these challenges to say that, I really want to be out there to support my students, and these students need significant support. And so what can I do as a faculty member to support those students? And so I submitted funding to, first of all, to UCSF. They have internal funding, seed funding, and received an award for a one-year funding to launch the FirstGenRN program. I'll get into the details in just a moment. And then for the past 2 years, I've been funded by the California Wellness Foundation. So been very grateful for their support, and currently have some funding under review, possibly for funding at HRSA. So hopefully that will get funded soon as well. So the FirstGenRN program, as I mentioned, was launched in October 2017. As I mentioned, this was through the seed funding. Currently now, there's about 90 students each year who are participating. It did drop off this past year because of the pandemic and just, life in general and how everybody moved to remote learning. So we were challenged this past year, so we had to shift gears a little bit. Currently, the program is in 4 schools, UCSF, California State University East Bay campus. There are 2 campuses that have nursing programs. There's the Hayward campus and the Concord campus. And then also Hartnell College, which is a community college down in the Salinas Valley, which I'm going to talk about at the end of my talk today. And so prior to COVID, and we did manage to hold it up on a monthly basis. During COVID, it just was in a little bit different format, is to hold monthly sessions. I'll go into some detail about what that is in a moment. Some ideas, some examples are giving back to your community, time management, writing support, and how to work with an editor. Also have held a faculty development workshop with faculty on how to best support first-generation college students, collecting some data, primarily demographic data, persistence data. We know that first-generation college students, while they have tremendous challenges that they face, have an incredible amount of grit and persistence. And so I want to capitalize on those strengths. And so really using a strength-based approach to this program. And also looking at stress as another item that I'm collecting data on. I'm also collecting some qualitative data, have some really, really wonderful quotes. This is one of them, being what it means to be a first-generation college student, specifically nursing student. It means that I will be paving my own path with the hope that friends, families, colleagues will be supportive. Almost everything is a new experience. Despite the challenges that come with this label, I cannot help but feel proud to be first generation to college and to be breaking barriers as well as paving the path for future generations. My students describe this experience as navigating without a map. They are charting in an uncharted territory. And so this program gives them some structure to help them be successful. As I mentioned, we have monthly meetings. They moved to Zoom this past year. And we were also able to have combined meetings with the different 4 schools because of the Zoom. So that was a benefit that came out of it. But there are 12 modules that we focus on: caring for our communities, managing a panel of patients, more focus around time management, how to apply for scholarships, investing in the future. We know that students who are first generation college might not have received education from their parents about how to manage a budget or how to invest in their money. Nurses generally make good salaries when they graduate. So how can we best support them so that they're most successful financially when they graduate? We talk about mentorship, giving and receiving constructive feedback from mentors and faculty. Also professional development. And I have a student, an editor that I work with who comes in and talks to students about the importance of receiving editing support during their program. Also alumni networking, how to use your networks when you're in school and out of school. And how to best pass the certification and licensure exam, as I mentioned, the NCLEX failure rates being higher among certain groups. And then also around just collaboration and interprofessional leading in caring for the underserved. Ideally, we hope that our first generation college students, again, going back to that care concordance, will go out and work with the communities from where they came from. And so those are more likely tend to be in underserved areas. We have, my students come from some really, really incredible communities. And that's the one thing that I like about this program, is that we're all diverse we all look different. We all come from different backgrounds, but we come together with a shared learning about an experience that we all share. As I mentioned, there's also faculty development workshops. So this is really focused on how do we best support students from the application process, the pre-admissions process. all the way through to graduation and then beyond. So we look at admissions. How can I best support a student when they're writing their admissions, going through the admissions process, reading their goal statements, editing their goal statements, meeting with them in advance, identifying, that how do we best identify first generation college students if it's not an item on the application process. At UCSF since 2012, we have been, actually the entire University of California system since 2012 has been identifying students, parents, highest level of education. So we know who our first generation college students are. Not all universities have that as an item on their admissions application. Continued mentorship, and then also graduation, how to be successful after graduation. I had a student contact me after graduation, just being so thankful for the support that they got. They had paid off all their loans and were just so excited that they were able to pay off their loans. And just, once first gen, always first gen. And so I continue to live with the identity of being first gen, and I'm a faculty member now. So it will always follow you and will always support your growth as a first gen student. So these are some questions that I ask students. What are some conversation starters that you would want faculty to ask you about being first gen? So these are just some open-ended questions that that faculty members could ask about. If instead of just saying, are you first generation college, maybe what would be a different way to ask that? So I'm interested in learning more about you. Where did you grow up? Are there any difficulties and hardships in your life as a graduate student? How would your high school experience compare to your college experience? What brings joy and passion in your life? So really conversation starters to help open that door and create that relationship between the faculty and the student. As I said, I'm very much focused on strength-based, looking and identifying what the student's strengths are and not focusing on a deficit model. Another focus of the FirstGenRN program is sustainability. I'll be talking about the visibility campaign here in the next slide. As I mentioned, my project has been funded by foundations. I have something currently, and under review for funding with HRSA, and then also philanthropy. This past year, I received a $250,000 gift from a donor for an endowed scholarship for first generation college students in my program. So that was really exciting for me that our first gen students are being supported. And then also something I'd like to start this next year with the grant funding is really having the students take charge and leadership of this and start chapters at schools. As I mentioned, we're in 4 schools right now, would like to expand that. Frank Molina is my current research assistant on this. He grew up in the Excelsior neighborhood here in San Francisco. He's bilingual, and he is just, he's all over campus because of our visibility campaign, which I'll share with you in just a moment, but really talks about his struggles and strengths as a first generation student. So we had, had a photographer follow him around all day and the work that he's doing with underrepresented populations here in the city. This is the visibility campaign. Excuse me. This is just some of the examples of visibility campaign. We've done a video. I have a Facebook page. If you want to sign up for FirstGenRN, I can sign you up. Just go to Facebook and type it in and sign up. I also did a poster campaign, had a photographer come and take photos of my students and talk about, really, as I mentioned, strength-based. I am community was one of the words that came out. Each student had their picture on a poster. My phrase for me, my one-word phrase was, I am titanium. And that's how I feel about myself. And so everybody, I'm resilient. Different students had different words for themselves. So it was just really powerful. And we hung those up all over the school. I do want to also talk about the first generation support services at UCSF. Currently, 30% of our students at UCSF identify as first generation college. The greatest number of students at UCSF, it's a health professions campus, is nursing. When I started the program, less than about 25% of our students were first gen, and now we're almost up to 50%. So because of the work that I've been able to do with the faculty and our other first gen faculty, we've been able to increase the visibility and the importance of first generation college students in our programs. One of the biggest areas that we see as a need on campus is basic needs and food security. So we have a weekly food market that our first generation college students participate in. And so I just wanted to mention the importance of food security for our students, and that they're getting signed up for benefits so that they can have the support that they need. We have a number of programs. We have a text messaging food for students program. Certainly pre-COVID, this was very popular. If there was an event on campus and there was leftover food, you could text message students and they could come right away and get the leftover food. So there's just a lot of creative ideas focused on food security. I briefly want to mention my relationship with Hartford College. It's one of the campuses that I'm focused with. It's a community college in the Salinas Valley, which is named the Salad Bowl of America. It's primarily farm workers. So a lot of my students at Hartnell College are children of farm workers, and they are first generation to college. And so really thinking about what is the value of these students going to have on building community, building health, and improving the public health of the communities in the Salinas Valley. They have a partnership program with the local youth, and they start all the way in elementary school, middle school, high school. They have a number of different programs at the community college. I just wanted to show you the breadth of that here, but they focus on getting students through the pipeline in various ways. That Hartnell just has a really wonderful program in cultivating the careers of health profession students in the Salinas Valley. So if anyone wants any more information about that, I'd be happy to connect you with them. One of the key successes to that is a parent organizer. This parent organizer is in the community, knows how to work with the community, and really focuses on working with parents, other parents, peer-to-peer contact with people in the community to encourage their children to go to college and, ideally health professions as well, and getting them out in the workforce. So with that, my time is up, and I think Polly's going to moderate a discussion here.
Yeah, thank you, Laura. Super inspiring, I have to say. I mean, you, as a first generation student yourself, having such a tremendous impact on this issue is such a great example of why we need more diversity in our faculty in schools of nursing. I mean, it's just extraordinary what you've been able to achieve, and your own personal story was really important. It's not just a coincidence that you're also first gen. So
Yeah.
that's really a great testament to the importance of diversity in our faculty. So I wanted to kind of back up and focus on some of the policy recommendations that have come from the Institute of Medicine and its implications for diversity in the nursing student body. As most of us will recall, in the 2010 Future of Nursing report, there was a recommendation to increase the percentage of nurses that had received a BSN to 80%, and I think it's around 60% or so now. And actually recently, I think in the last year or so, it might be declining slightly. I think there's been a little bit of slippage. But one of the concerns about that recommendation was the possibility that there could be an unintended consequence of making nursing less accessible to first-gen students and to minority students. And in some ways, it seems that your program is addressing that concern, in a very frontal way and with enormous success, and would suggest that this is a problem that can be addressed in BSN programs. But I wonder if you could reflect on the issue of sort of the pathways into nursing. You're working with a community college, you're working with your own BSN program, and the articulation agreements, and how you're seeing this issue of sort of the importance of continuing education, and whether that in any way is something that you have to take into account, and how you can sort of compensate, if you will, for any barriers that might be erected as a result of these higher educational aspirations that are being incentivized, if you will.
Yeah, I'm so glad you asked that question. I think one of the most important policy implications for this around the admissions process is not creating barriers for students. So one example I can give you is requirements for the GRE. or that's what we have at because I'm a graduate level campus, or requirements for the SAT or the ACT. Those can be very limiting for students. And so some schools are moving away from requiring standardized testing. Actually, the University of California is moving away from that. So I know that it's been a really, really, really messy hot topic around what are our admission criteria for nursing students, because we want to maintain safety and we want to make sure that our healthcare providers are safe and our patients are safe. And so that's been the argument on making sure we have a high quality workforce, highly educated workforce. And so I would want schools, it doesn't just have to be nursing schools, but health professions students in general, focus on a holistic applications process. So, thinking about how can we minimize or eliminate the use of standardized testing? What strengths does that student bring to the table that might not have been considered in the traditional admissions process? So I know that that's an area of education that we've had at our school, is looking at applications holistically and looking, as I've mentioned several times in my talk, a strength-based approach.
Mm-hmm. That's interesting. And in terms of the articulation of the associate degree programs and the community colleges with the universities and four-year programs, are there any particular examples that you think have been very successful in terms of ensuring that particularly this subgroup of students have access to opportunities to continue their education?
Well, that's an interesting question. I think where it also starts is at the LVN level. And what I've seen. So we have, many of these students started at the LVN level. So we have them going LVN to associate degree RN. Hopefully they can get to the baccalaureate degree RN. So working with campuses that have a clear pathway program, I think is looking for models of care related to that. And so that's what I would say about just different agreements and models of excellence. And that's why I really like working with Hartnell College, because they have a clear model of excellence around getting students starting at the LVN level. And we have LVN students in the FirstGenRN program because we want them not to stop at the LVN level. So starting them as soon as possible to get them to think about how can they move through to go to baccalaureate.
So we welcome questions from the audience and the participants. I'm not seeing any yet, so I'll forge ahead with another question. So you talked a little about the literature on concordance and mentioned that it was largely focused on physicians and largely focused on issues of race and ethnicity. If you were to imagine a research program on concordance for nursing, how would you approach it, and how would you think about this issue of first gen students as well as part of the concordance equation?
Yeah, so I've thought about this. Obviously, I would look at what databases like NSSNRN or other databases, the Medicare data sets, where we can maybe look at what the provider's language is and what the patient's language is, specifically around nurse practitioners or nurses. So there's different databases out there. I'd like to look at analyzing some data to see if there's this, looking at the concordance specifically around race, ethnicity, language. That is kind of a proxy measure for first gen. Would want to know more about how can we add first generation, whether the healthcare provider is first generation college. As I mentioned, we've been collecting that data here in the UC system since 2012. So we're able to look at some of that data. But as I mentioned, with the Biden administration starting to use that as a measure of, on applications, job applications, or on any kind of national database, NSSNRN, as I mentioned, just being able to increase the visibility of the importance of being first generation college.
So those are data sources sort of on the supply side to be able to identify nurses that are either first gen or minorities. But what about the interaction with patients? What about tracking that? Because when you do concordance research, it's really about whether the outcomes are better when you have concordance. So you have to look at patient level data. Have you given any thought to how you might do that with nursing? Of course, that's sort of a holy grail of how do you track
Yeah, yeah.
quality of nursing care and outcomes.
Exactly. I think it would be a little bit challenging, just given that patients interface with so many different nurses in the course of their time as a patient. So I would have to certainly give that a lot of thought. One of the reasons why I got interested in this, not only personally, but through the work in the Workforce Center, many of the nurses that I work with in long-term care are LVNs, associate degree RNs. So I was looking at that workforce, and many of them are first generation college or immigrant nurses. And so, looking at high areas where there are high proportions of first gen nurses might be one area of being able to best research this, so that I can control for a number of variables within the context.
Do it at population level, not at the patient level.
Yeah.
So we have one question from Lisa Hunt. Have you created partnerships with minority serving institutions? If so, what have been some of the best practices?
Well, the Hartford College actually is a Hispanic serving institution. So, that was one of the reasons why I wanted to include them in on this project.
Is there a formal relationship between UCSF and the community college?
There is not, other than my project, no, we don't have a formal relationship, but definitely the community colleges here in California have formal relationships with the UC system in general. So one of the UC mandates is to dramatically increase the pipeline of community college students into the University of California system. And so I think, the more partnerships that we can have with community colleges, formalized partnerships between these baccalaureate programs and the community college programs, I think that's a great model of care around education, and I think that will reach more minority students as well.
What are some of the impediments that you see? I mean, obviously, UCSF is one of the great research institutions. There's a fair amount of elitism, if we may call it that,
Yes.
associated with research institutions, and the criteria for promotion and so on are often linked to how many, what your research dollar portfolio looks like. And the emphasis on that has often been kind of, to the detriment of thinking about a school's social mission. And in the case of UCSF, it is very prestigious. What are there obstacles to encouraging more partnerships of this type with community colleges and with minority serving institutions? What's the problem? Why don't we have more of that?
I don't know. That's a great question to ask. I mean, I'm a graduate, as you mentioned. We're a very unusual campus because we're graduate only. So we would have to primarily focus on the baccalaureate level at UCSF. But that's why I wanted to include Cal State East Bay. That's a baccalaureate institution, so they could certainly have partnerships with community colleges. So I think the more that we can look at baccalaureate programs with community colleges and creating that pipeline. I saw a wonderful model of that when I lived in Canada. As you mentioned, I have a research appointment in Canada. They've required now the baccalaureate degree in Canada as the entry practice of care. So the community colleges there were forced to partner up with a baccalaureate program. And so there were programs outside of provinces, like in New Brunswick, partnering up with community colleges in Ontario in order to deliver that BSN program. And so I think the more that we can create those creative partnerships, the better.
Terrific. Well, what about spread? That's always the important question when we think about one particular successful program. I mean, you've doubled the number of first-gen students at the graduate level in the UCS School of Nursing. That's pretty significant outcome. Why doesn't everybody do this? How can we help them to do it? How would you spread this model?
Great question. So part of the California Wellness Foundation grant, I will be hosting a conference. I was supposed to do it last year, but unfortunately the pandemic slowed that down. So sometime this year, I'll be hosting a conference to talk about all the different components of the program, kind of what I shared with you today. I think getting students to take ownership of this, getting student groups, having students be the leaders. The peer-to-peer support has been incredible. So me as a faculty member, member, the weight of advice to a student doesn't nearly carry as much as a peer student who might be a year or two ahead. So I create a lot of peer support in that. So the student chapters is something that I'm really excited about in creating the spread of that. And as we mentioned, just I have a publication in Journal of Professional Nursing on this topic. So just getting the word out more about the importance of how we need to better support our student population around first gen. And so that's what
a price tag that you could sort of a unit price that you would attach to this kind of a program. If you said to GW, where I am, here, take this is my new technology, what would it cost them?
Oh, that's a great question. Yeah, I'd have to think about that. We have all the materials open to sharing. Anybody, the modules that I've created. We're actually, Frank, who I showed earlier, is putting a website together to be able to share that publicly. So I really just want faculty and students to take this program and better support our students. And so
in theory, if you were to provide all the technical assistance, it might not cost a university anything.
Other than time, yeah, other than time, I do feed students. So to get people to show up, as I mentioned about the importance of food security, it's important to feed students a hot meal. So I do spend, this year I had to transition to Amazon gift cards because we're doing things virtually, but that does help my students to participate. So that could be a cost associated with it. And making sure that the faculty that's involved is first gen. That's part of the reason why I started the program. Was I was alone. When people look at me, there's this invisibility identity. It's an invisible identity. You can't look at someone and say they're first gen. People assume that I wasn't first gen because of the color of my skin. And I had to reach out to other faculty, even faculty of color, to see if they were first gen. And I was really one of the only faculty in the school. So that was part of the reason why I started the program.
Yeah, that's such a terrific opportunity to understand diversity in a sort of expanded sense and many of the obstacles that people face to be able to enter nursing and to continue in nursing. So terrific program, Laura, and kudos to you for leading it, for creating it, and lots to learn for other institutions around the country and perhaps even other countries.
Yeah.
So thank you so much. I think we have no other questions, and I think I will pass it back to David and conclude the webinar.
Thank you, Polly.
Thank you, Polly. That was a great job moderating once more. And thank you, Laura. It was a wonderful presentation. I really enjoyed it. And also, of course, thank you in the audience for attending our event today. But we by all means hope to see you again in the future. With that said, I hope everyone has a good afternoon. Thank you for watching the webinar. To view our extensive webinar library and other helpful resources, please visit us at healthworkforceta.org.